You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Dr. Pearlman, how are you?
I'm good. Thank you for having me.
Thanks for coming. I am very interested in your professional experience because we're facing a big challenge with this obesity issue, and I don't know how we're going to solve it, if we're going to solve it. What's your perspective on this?
You know, it's interesting. What I do on a daily basis today in my clinical practice, I learned nothing about in 14 years worth of medical training. So I went into gastroenterology because I was fascinated by nutrition, really on a personal level, and I wanted to learn more about it. And probably, 1 year into my gastroenterology fellowship, I realized we're trained as proceduralists and we learned about pathology and not about prevention. And it actually wasn't until my third year of gastroenterology fellowship training where I actually worked with the head of the weight management program at UT Southwestern as an endocrinologist, so outside of my own fellowship training. And that's where I got my first glimpse of weight management and GLP-1. So that was back in like 2018 when Ozempic was first starting to be used specifically for diabetes. And it's been fascinating ever since. So that's what I do really every day of my clinical life today is weight management. And, as much as I think we're making 10 steps forward with all of these, innovative therapies, honestly, you go to the airport and you walk around different areas, outside of South Florida. And I just tell myself, we are so far behind. We have so much further to go.
I don't know. The thing is that I feel like this GLP-1 trend that went on and on for now is like a quick fix of something that we'll never be able to conquer. And it's just a very superficial way of symptomatically, I would say, treat the cause. I don't know what needs to change, and I think a lot of things need to change, but I am curious from a gastroenterologist point of view, what is it that you actually looking for to change in this, field? Because I can't imagine, you guys treating patients that they're coming in and they say, oh, I want to lose 10 pounds. I want to lose 20 pounds. I want to lose 50 pounds and just prescribe a GLP-1 medication and be done with it. It seems so counterintuitive to me, with people that have basically no nutritional facts in their life, no nutritional education in their life. There's nothing out there that can educate us in nutrition, basically. Either, if you want to look in college, maybe to take a course in nutrition. Otherwise, nobody knows how to read labels. Nobody understands what's in those words in the labels because it's all like artificial stuff and things that we can't even pronounce. I don't know. Where do you start?
Yeah. I'll tell you at my prior job, so I worked at a large academic institution. I started their medical weight management program. I'll tell you, it was a challenge because I was the only physician that did weight management. So as you can imagine, my clinics were pretty busy and I was using GLP-1 medications and other weight loss medications for people. But they would say, Dr. Pearlman, I'll see you next month. And I would say, I'll see you in 6 because I literally just didn't have the access. But education is the foundation, like you mentioned, right? These medications are incredibly powerful and I believe beneficial, but without the foundation, without proper nutrition, getting enough protein, protecting the gut microbiome with dietary fiber, minimizing side effects, doing the right activity, not just telling people to exercise, which is what I used to do. I used to tell people, I just need you to move your body, which is a start. The reality is as we get older, it's all about preventing frailty and fracture. And so doing the correct exercise is really important. And then also trying to make sure we're not promoting injury. So all those things will never replace these innovative therapies. But I will tell you that these medications are very helpful tools. The process of losing weight, and more so the harder part is maintaining the weight loss as life happens. These medications do not make it easy, nor do they make it painless, but they make it a little bit easier and a little bit less painful. The majority of patients that see me, I have a concierge practice in Miami, Florida. The majority of patients that see me have struggled for decades. and they've tried diet after diet. They've kind of listened to the old paradigm of eat less and move more, and it didn't work. So typically the patients that are seeing me, they're not just wanting to lose 5 pounds to get a six pack. They have true metabolic issues where they need a tool in the toolbox to help them be successful. So that's really where I come in. But again, my consultations, I spend an hour and a half to 2 hours with them and go into the nitty gritty detail on what are you putting in your coffee? What do your snacks look like? If you travel a lot, what are you doing at the airport? Because I really need to know all that information to then figure out what are small changes we can make to help someone be successful. You can buy any book online. You can go to all these, social media influencers and say, do keto or paleo or Mediterranean. But if you travel all the time for business, how do you fit that sort of nutritional plan in when you travel? So it's figuring out how to take, these kind of bite-sized steps to be successful. But the medications are very helpful in addition to the foundation. So I don't know if that answered your question, but a lot of people struggle with metabolic
I'm trying to ask a question in a very nice way, but you mentioned something about, all the food that's out there for us everywhere we go, right? The airports, the grocery stores, all the shops in the mall and stuff like that. And it seems like no one looks at what that means for them. And the other day I wasn't in the airport actually, and there was a place where you had no nutritional data on the food, and I ordered a cheeseburger, and I looked it up, and that specific cheeseburger from that shop was 1,100 calories. So there was one meal that people say, okay, I'll just get a snack and I'll get a cheeseburger for 1,100 calories. Where do you start here? Like, how do you manage a patient like that who thinks he gets a snack and then he comes in for weight loss management? And he's willing to do whatever it takes because he has no concept of where he should stand. Like, I did an exercise once in a while of logging in my food in my fitness pal, and you're amazed of how many calories you can get a day from little things here and there on the counter, in the pantry, in the kitchen, in the airport, whatever it is. And it adds up and adds up and adds up. There's not enough GLP-1 medication in the world for all of us doing that.
Yeah. Well, I think part of the issue is, the lack of education. I mean, we learn eating behaviors and habits from when we're babies. We're given juice when we're crying because it helps soothe us. So it literally becomes, we have these addictive behaviors because we're fed juice as babies, and that kind of rewires the brain and creates all this dopamine and other neurotransmitter release that gets us hooked from a very young age. Then as we get older, we're kind of rewarded with snacks and birthdays, all of these celebrations and holidays. So I don't blame my patients for making those decisions. The reality is that's the world we live in. You go to any airport. I went with my sister a couple of weeks ago. Literally, she was scouring the airport for just like plain almonds and couldn't find it. She finally found a container. It was the only thing that was unprocessed at the entire airport, but it didn't come in a little snack bag. It came in a container that had 6 servings. So if you're not paying attention and you're on a long flight, you're eating, over 1,000 calories worth of almonds, even though it's healthy. Sometimes too much of a good thing can be a bad thing. So our environment is just not set up for success. Sugar is highly addictive. It is more addictive than cocaine, heroin, alcohol, and nicotine. Now, if you wanted to, let's say you were, on cocaine and you wanted to come off, you can go to a rehab center. And as long as you take yourself out of the environment, it's doable. The problem with sugar, it's everywhere we go. Even in the hospital, when you seek medical care, one of the reasons why I left my prior institution is they were not ready for a culture change when it came to taking the Ensure and the Boost and the juices off of the hospital menu. We are giving people diabetes, and then they're leaving the hospital with on insulin when they never had insulin issues to begin with. It's so backwards. So there's a lot of people to blame. The reality is there's a lot of money in food. There's a lot of money in sickness. Hospitals make money off of sick people, not off of prevention. So my sister and I 2.5 years ago kind of got sick and tired of it, and we were tired of complaining. And so we started our own practice where we were able to make prevention profitable and help a lot of people and get paid for focusing on prevention, which is a beautiful thing because in typical healthcare scenarios, as a gastroenterologist, I got paid for doing colonoscopies and endoscopies and making diagnoses, not for education.
So tell us a little bit more about the practice right now. How did you structure that? What's the business model? And what do you want to achieve with it?
Yeah, so we started 2.5 years ago. So I'm a gastro. My twin sister is a urologist. She directed the Men's Health Center program at the University of Iowa for 5 years. So around the same time, we both kind of came to the conclusion that we needed a change. So we both went to our parents and said,
You can
"Mom,
only
Dad."
do this with a twin, right?
So we went to our parents and said, "Mom, Dad, we're both leaving our very secure salary and we're going to start our own thing." And my mom, I remember she said, "What if they offer you more money?" And I said, "Mom, it never had anything to do with the money. It's when you show up to work and you're anxious because you're already starting late because you have two patients booked at 8, two patients booked at 8:40, and you have to apologize to every single patient for running late because your schedule is completely bombarded with patients. It's not a good feeling." And I just wasn't able to offer the care that I knew my patients deserved. So we took that leap. Now we've met a lot of providers along the way who would like to open up kind of their own concierge subspecialty practice. But the reality is, you have to be a hustler. Like, we work weekends to accommodate patients. The computers do not close at 5 p.m. As much as I don't feel like networking and joining a bunch of business groups and showing up, at 7 p.m. to events after a long day, I do, because you have to build your brand. So I would encourage people, even if you are at a large academic institution or within a practice, start building your personal brand and don't label it with the university or group that you're in. Label it as yourself, because your brand, if you decide to leave and choose another career or another practice, you can always take that with you and it's not affiliated with one particular institution. So we had started building kind of this joint brand actually years before we had any sort of plans of leaving. We had created a educational website for patients. And then, so we took that leap. We were without salary for 6 months, and we started seeing patients. So I focused primarily on nutrition, weight management, and my sister was only seeing men and focusing on men's health and sexual health. And it's interesting because a lot of people ask us, what in the world, it sounds like a joke, what in the world is a gastroenterologist and a urologist doing in practice together? Like, what are the synergies? Well, one is the GU organs, right? The bladder, the prostate, those sit very close to the GI organs, like the rectum. So a lot of patients that suffer from constipation or other defecatory disorders also suffer from urinary conditions. So the pelvic floor is kind of that common denominator. So that is kind of one synergy. The other synergy is a lot of men who struggle with metabolic disorders, whether it's insulin resistance or difficulty losing weight, also have hormone issues like low testosterone. Now, we often tell men to just lose weight and their testosterone will get better. I just don't see that pan out that much in clinical practice. What we did see is that our most successful patients were our mutual patients, where my sister was optimizing their hormones with testosterone. I was treating their metabolic conditions and helping them lose weight, and they were killing it. They were losing 30, 40 pounds, preserving muscle and bone mass, and hitting PRs doing marathons. And so her and I got together and said, if we can do this for men, why can't we do this for women? And I looked back at all the women I was seeing and I was like, holy cow, they're all going through perimenopause. And that's a big reason why their bodies are changing. They're gaining a bunch of weight. All of a sudden they have high cholesterol, because estrogen is incredibly important in, obviously hormones, but cholesterol, metabolism, weight, insulin resistance, all that stuff. So then my sister and I actually more recently got certified as menopause providers. So initially we had a very niche practice, but honestly, hormones and weight affect every single organ. And so it's actually become quite interesting, the journey.
Very interesting. Yeah, it's a field that I think it's not very well served, I would say, because from what I know and I've seen, gastroenterologists are procedure-based doctors, right? So you guys make a lot of money by doing a lot of procedures, and urologists the same. But combining this two, it's a great idea for, like you said, serving a very definite segment of population that has both issues coming together for weight loss and hormone balancing.
And nutrition is so important. So when I used to do, diagnostic endoscopies, patients would wake up and say, "Doc, what's wrong with me?" And I'd say, "Bob, great news. Everything's normal." Bob wasn't happy. Bob wants a diagnosis. He wants to know why he's bloated. I didn't have the time to open up Pandora's box when it came to discussing nutrition, right? I could say, okay, follow a low FODMAP diet to help with the gas, but those diets are very complex. If you get, let's say, a patient with ulcerative colitis or Crohn's disease and they're struggling with their weight, you can't just tell them to eat more fiber and protein. They're going to have massive diarrhea and never come back to see you. So when you have underlying gastroenterology conditions, when it comes to losing weight and feeling well, there's actually a lot of nuance, that comes with it. And we can't just turf people to dietitians and expect them to have these complicated discussions. It's got to come from the provider.
Right. Let me go back to your own self a little bit more. And it's not an easy place to be, right? For you as a woman in a very, I would say, high-end area in Miami to start a business like this. How do you manage your time? How do you manage your priorities? What kind of mindset do you have to accomplish all these things? Because between the family life, the professional, the office, the private practice, getting in touch and networking and, trying to build your brand, that's, do you have time to sleep?
My schedule is it's not for the faint, that's for sure. My situation is probably different from most people my age. So my twin and I were 39 years old. We don't have kids. We're not married. So it's probably a little bit easier for us because at the end of the day, we're not coming home to help our kids with homework, right? So I'll take that off the table because our life, again, at our age is probably vastly different from other people our age. The other thing is, a big part is, when I was in my prior job and I saw people 10 years my senior and they didn't seem happy and I was supposedly having my dream job, I refused to become bitter. And I said, 10 years from now, am I going to regret staying here or do I need something different, right? We always say, okay, the grass is always greener on the other side. Sometimes it's not, but sometimes we don't need grass. Sometimes we need concrete or gravel. Sometimes we just need a change to get a little bit refreshed. It is not easy. Now, I'll tell you, for someone to come out of training and then expect to go into a concierge practice and have people just show up at their door willing to pay, cash for services, that's not realistic. My sister and I put in our work at academic institutions, built our brand, built our reputation, got the experience, understood how the healthcare system was working, and figured out what are ways that we can maybe change things to make it work a little bit better. Within a large setting, you work with so many people and you feel like you have to have so many people working to get the job done. When my sister and I started our business, it was literally it's her and I, and we have a remote assistant that works out of the country to answer the phones. We have an accounting firm that does our bookkeeping and accounting. We have obviously the electronic medical record, and we have someone that kind of manages our practice at a high level based out of California. But no one else is in the office between my sister and I. You kind of figure out how you can create a lean team and get everything done and minimize the overhead. Which is really the biggest thing. My life could be a lot easier if I had a lot more people in the office doing a lot of the day-to-day things. But I choose to do that because I would rather, put the money back in the business to give ourselves kind of some leeway and more capital to expand in the future than pay more people to do things that I can very easily do that I may not want to do, but I can easily do. So I think part of it is you're not going to have your dream job right out of training. You got to put in the work, build your brand and reputation, and then kind of see, what avenues there are. And then as far as like how I structure my day, so exercise is the foundation. I was talking to actually a neurologist yesterday and she made the comment, there's an association between muscle atrophy or muscle loss and brain atrophy. You got to exercise the muscle. You got to build muscle to help protect the brain. And I thought that was so interesting. So every single morning I'm up at around 4 a.m. I get my workout in. It's a non-negotiable. And then I'm, heading to the office to see patients starting at 8. And then I just try to be very efficient. So depending on my schedule, I'm seeing patients, let's say back to back with a little bit of gap in between. And then reps will come by or I'll set up meetings or do podcasts. I'm actually CEO and co-founder of a nutrition platform that I'm actually launching hopefully in the next month or two. So I'm kind of I have my hand in a lot of different things, but that's what keeps it so interesting. Because honestly, seeing 20 patients a day, day after day, it gets boring.
Yeah, it's, I don't know if you call it boring. I call it burnout after a while because it's very taxing. We should have had your twin sister on the podcast too.
Yeah.
So,
and then
Michelle,
the other thing I was going to mention real quick, though, is surround yourself with people who have done it before. Now, I'll tell you, people in medicine are the worst business people because we've had absolutely no training. And I think that's for a reason, so that honestly, the medical system kind of captivates us within the system and we're too fearful of getting out. I think, honestly, there's probably some reason that is why we have no business training, which is pretty awful. So I reached out to a bunch of private practice physicians to understand, like, how did they start it? And honestly, I didn't do probably the majority of it because some of it just didn't make a whole lot of sense. What I did do was I surrounded myself with entrepreneurs and people who have built businesses and exited businesses outside of medicine. And that's where, honestly, I learned the most.
Yeah, that's a key thing. We can know everything. We just have to find the right people to learn from.
Yeah.
And mentor us or show us the way It's very interesting how things work, because nobody knows everything, right? And everybody needs help at some point in their business. But also, I think being successful in what you're doing right now meant that you went through some tough times, because that's how you learn. Can you give us an example of what that was for you? Was there any moment you were like, I'm done. I'm not going to do this. I don't know how to do it. It's so hard.
Yeah, I think and honestly just the initial setup of the business, because I had reached out to other practices, but they were mostly internal medicine, and there's more obviously internal medicine concierge practices out there. I didn't have someone to go to that had like a subspecialty practice within urology or gastroenterology. So one of the biggest challenges is actually, I still want to do colonoscopies and I still perform colonoscopies. I spent a lot of time in training learning that skill, for which I don't want to lose. My sister is a surgeon. She did 6-8 hour surgeries in Iowa. She doesn't want to lose those skills as a surgeon. One of the biggest challenges was understanding how do you set up like a subspecialty procedural surgical practice when I'm basically a solo practitioner in my practice and my sister is a solo practitioner in her field. What we realized is, a lot of hospitals will be more than happy to give you privileges, and ambulatory surgical centers are more than happy to give you privileges, but you need to find a physician that's going to cross cover you in the event of an emergency. And they really have no incentive to cross cover you on call because you're not seeing each other's patients, right? So why would someone sign their name on a dotted line and say, I'll cross cover your patient when you're not part of the same practice? So part of that was kind of just navigating, well, how do you keep your procedural skills and be able to do surgeries at a center but get people to kind of get your back for legal purposes? That was a big challenge. I had already built my reputation in Miami because I was here in Miami. My sister, it was a challenge because she was in Iowa, very well known in the professional circuits, but no one knew who she was here. So that was definitely a humbling experience for her. And it was hard for me to kind of witness that. She was a big time surgeon in the Midwest. And when she came here, she had no patience. To go from a surgeon and then she was answering phones for me and my patients, she had to eat a big piece of humble pie. So you always got to start somewhere, and it can take a lot of time to build your reputation in a new place, especially like Miami. It's a very big but a small city, and you got to get to know people. And her practice is booming. I mean, she offers procedures that, like girth enhancement for the penis and some other procedures. She's more of like a cosmetic urologist where people travel from all over the world to come and see her. So it's quite fascinating. She gets a lot of patients from social media. I get a lot of patients from concierge providers in the area that are more local. So even though we're in the same practice, we actually get our patients from pretty different areas, which is interesting. But yeah, growing the practice can be a growing pain. You can't expect people, especially in the concierge field, to just show up at your door. But I will tell you, if you're a good person and you provide good quality care and you answer the phone and you provide access and you educate and you treat people well, people talk and they will come.
Yeah.
So it's all about customer service, and you don't learn any of that either in medicine.
Right, exactly. Because we're not trained for medicine as a business. We're trained for medicine as a treatment option for chronic diseases. How did you navigate this, like changing the model from insurance model to a concierge-based cash payments? I mean, like you said, it's hard to imagine someone sitting in line at your office just to pay you cash.
Yeah, there's a couple things. In the insurance model, I'll tell you, people don't like surprises. People don't mind paying for medical care if it's reasonable. They don't like surprises when they get their colonoscopy and then they get a bill in the mail for $6,000. People want to know upfront. You call to get a massage, you know what the cost is, But it's interesting because dermatologists, cosmetic dermatologists, they have no problem giving you a bill for $2,000 for Botox. So we kind of just went off that model, right? You provide services. Here's the upfront cost. You're either willing or able to pay for it or you're not, but at least you know upfront. So I think that's honestly a big positive is people want to know upfront and then they can decide what they want. Healthcare is some of the, most profound expenses we have. What's worse than being admitted to the hospital? You get treatment for a couple of days for a urinary tract infection, and then you get a bill for $20,000 in the mail, right? People don't like that. So although, people are typically going through the insurance model, there are so many kind of secrets and unknowns within that system that really frustrates people. The other thing is within my space, as it pertains to weight management, the reality is the GLP-1 medications are very expensive. People are paying $500 a month. So it's very hard to get them covered by insurance. Even if you meet all the FDA criteria in the world, the minority of my patients actually get the medication covered by insurance. So the reality is, if people are not willing or able to afford $500 a month for the medication, then they're probably not going to want to see me, So it also just depends on the services you're offering. And the other thing too, I'll add, is insurance will never pay you to sit with a doctor for an hour and a half or 2 hours. So it drives a certain patient population. If you're fine sitting with a doctor for 15 minutes and leading potentially with more questions and then having follow-up in 3 months to get those questions answered, totally fine. But that's the current healthcare system. If you want an hour and a half with a physician, you got to pay for it, just like an attorney. That's just the way it is, because physicians cannot generate a profit or just even sustain a business if they're getting paid $30 to see a patient per visit. Like through typical insurance, a colonoscopy, a gastroenterologist gets paid about $150. Yet facility and anesthesia costs are usually several thousand. So patients often think the doctor gets a lot of the money in an insurance system. It's not the case. That's why they have to see 30, 40 patients a day. It's to just honestly take care of the overhead.
Yeah. Michelle, what's the future for you in this field? Like, what do you want to achieve with it? Where do you want to go? Mm-hmm. You mentioned something of a nutritional platform that you want to build up. Tell us a little bit about that.
Yeah. So the reality in my practice, only a very small percentage of the population will show up in my clinic to see me. My sister and I are always trying to figure out, how can we make our knowledge and expertise more accessible? Whether it's doing, let's say, podcasts. My sister actually leads a few podcasts. Whether it's, we have corporate wellness partnerships. So there's a large accounting firm, Kaufman Rosen. They're an international firm where we actually do seminars, quarterly seminars with their firm, and they get 30, 40 staff there, and we do educational seminars. Whether it's going to health fairs, right? I mean, we donate a lot of our time for free to educate people, whether it's online or in-person events. We host events at our office. Specifically within the GLP-1 space, you have all of these virtual platforms coming out like Row or Weight Watchers or Noom or Hims that are basically writing scripts for people. And as much as that's great to improve the access to these medications, the reality is no one is talking about nutrition. We know that 12% of the population has been on a GLP-1, 6% are kind of currently on one, and over 60% of patients on GLP-1s have side effects, specifically GI side effects. But no one is counseling people on a mass scale how to mitigate a lot of these potential side effects and complications. And it's not just, suffer through the nausea. If people are having a lot of nausea and not getting their protein, they're now at risk for sarcopenia and bone loss. That doesn't have to happen if people get the education specifically around nutrition. So that's where ByteMD comes in. So with ByteMD, which we hope to launch in the next 6 weeks or so, you're able to track what you're eating, but it has to be easy, right? So people don't want to have to search through a menu and look through 50 different options. So you can voice to text, you can text it, you can take a picture. So with image recognition, it's going to pull up the ingredients. So instead of you having to type in edamame chickpeas chicken, it will identify those ingredients. So it's more ingredient based. We're obviously pulling in information on protein, macros, calories, but it's pulling in ingredients. Then you're able to track any sort of gastro symptom, heartburn, bloating, diarrhea, constipation, abdominal pain. And then using AI and machine learning, it's going to help you identify what your triggers are. So it would say, initially as it collects data, it would say, okay, garlic is a common offender for bloating. As it learns more and more about the user, it's going to say, okay, you did fine with garlic last time. It looks like it's actually the onion in the seasoning that's causing your bloating. And then it will feed in a recommendation engine to give you options on ways to minimize those side effects. And then there's the whole GLP-1 component. So you're able to track what you're on, what dose you're on, what are your hunger signals. And then, because what people oftentimes forget is with these medications, when you start the medication, when you go up on the dose, or within the first day or two after the injection, that's when people tend to have more side effects. So whatever nutrition plan you're on, that's going to change every day of the week. So we can't just tell people to eat more protein and eat more fiber, because day 1 to 2 after your injection of a higher dose, you may be really nauseated. That nutritional plan may be vastly different than day 5 to 6 of that same week. So we need to collect the data to then give people personalized nutrition information to help them mitigate a lot of these side effects as more and more people go on these medications. It's now FDA approved for moderate to severe fatty liver. Zepbound is approved for sleep apnea. So more and more people will be put on these medications outside of just diabetes and weight management. And we're going to have to figure out how to take care of these people when it comes to the foundation.
Very interesting. Yeah, I think it's a very helpful tool for a lot of people to have this at their, in their phone, basically, because nowadays everything is like mobile, and you snap a picture of what you eat, or you hear the name of the meal or whatever, and the AI does the work for you. Now, going back a little bit to your business model here, when you how do you integrate this new platform that you're building into an idea of maybe exiting in some way? Like from the business point of view, do you plan to use that as something that's going to help your practice, like maybe grow in a franchise model, or you want to plan to, let's say, sell the app to a future developer that can bring it at a different scale? What is the purpose from the business point of view?
Yeah. So they are two separate businesses. Obviously, I will use the app in my patients because, I see my patients on a monthly basis, but I need the data. I ask my patients, what are you eating on a typical day? And they often forget. And so it's really hard for me to calculate protein goals or know how to titrate the medication and look at their muscle loss if I'm not quite sure what they're eating. So obviously, it's for partly selfish reasons to help me help my own patients. But then the other part of it is, how do I help so many other people who are going to be on these medications who will never see me? Whether or not we plan to do any sort of integration to help grow Prime Institute, we kind of have to see. The reality is once you kind of franchise, or let's say you get bought out by private equity, it just dilutes the value. People come to see Prime Institute because they're coming to see my sister and I. If they wanted to just see a random provider, on a virtual platform, they would do, a virtual platform. So we don't want to dilute the value that we offer. So we kind of have to see how it pans out. The other thing my sister and I have realized is managing people is very challenging. Very challenging. We've had multiple assistants work with us. I don't think my sister and I are too hard to work with, but we do have very high expectations. And you have to when you have a concierge practice. So finding people who want to work, who want to show up to work, who have the medical knowledge, but like I mentioned, have customer service, know how to have conversations with patients on the phone and make them feel comfortable. When it comes to weight management and sexual dysfunction, these are very vulnerable topics. We can't expect someone to call up on the phone and say, I've been having erectile dysfunction for the past 20 years and my marriage is broken. Like, we expect them to open up to a stranger on the phone. You got to have good people who can have those conversations. So in order to expand, you need more people, and to find those people is very challenging.
Yeah, no, and everything is done with people, with good people. Yeah, I agree with that.
So
And
you
they
can
need to
use
buy into your
technology.
culture too. You
Yeah.
develop a certain way of doing things there, and like you say, there's sensitive topics. It's not like you come and get your blood work done.
Yeah.
Um,
And you can definitely use technology to obviously take care of some of the low hanging fruit and automate things. But what we've realized is as technology becomes more powerful, we as human need to be better at being human. When you call the credit card company and it's all automated, it's so frustrating. When a human actually picks up the phone, it's like such a sign of relief. We need to be better at communicating with people, at relating with people, sitting down with patients, and not just listening, but hearing what our patients are saying. And that requires time. It doesn't matter how smart you are as a provider. That requires time. It's going to warrant a complete paradigm shift when it comes to healthcare. Unfortunately, I see it as only getting worse, with reimbursements going down, people getting sicker, specifically in South Florida and Florida in general. It's an aging population. Providers are so burnt out, they are leaving medicine in groves. A large percentage of people who go to medical school don't even see patients clinically. They do research, they go into industry, they do consulting. So I think many people just don't realize the physician shortage that we have, and I think it's only getting worse.
yeah, yeah, that's true, and that's what makes your practice a little more attractive. Say that people realize that even if they have to pay a little more out of pocket, they have your attention for an hour or two.
Yeah. And oftentimes people, kind of what we call doctor shopping, but, people will go see multiple doctors, right, for the
Yeah.
same issue. And it's not because they just have high expectations and they just want the perfect doctor. It's because they have no time with each person, that they're not even getting one opinion, right? They're trying to get one opinion, but there's no time to get it, that they constantly have to go to multiple people just to kind of somewhat understand what's going on. So we've a lot of work to do. And I think, as more and more people get burnt out, I think kind of by my generation are becoming more creative and just saying, hell with it. Now with social media, it's much easier to build your own brand. And we're just getting creative to figure out ways that we can help people, but also honestly be happier, healthier people ourselves.
Yeah. Michelle, when you look back into your life and your career with what you know right now and your experience, what kind of advice would you give to yourself?
I think just like throughout training, we are kind of pressured to follow a very specific path. And I think, if we don't follow it or we take time off, it's frowned upon, which I think is pretty awful. I would say, a couple of things I've learned along the way is you got to be in the right room at the right time, right, with the right people. But oftentimes you have no clue which room that is. So as uncomfortable as it is, you just have to show up and put yourself in every room possible. And oftentimes when I go to these networking events and whatnot, I often think I'm going to meet certain people who I don't meet. And the people who I actually meet that create lasting relationships and extreme value are people that didn't even pop into my mind.
Yeah.
Like my sister and I sponsored an event with the Coral Gables Chamber it was all about AI in healthcare. And one of the panelists came up to me after and we started talking, and he's now our chief technology officer for ByteMD. That I never anticipated that. So I think honestly, a lot of people just won't show up. If you show up, that's like half the battle. If you engage with other people, that's the other part, So I think part of it is just get comfortable being uncomfortable, and showing up and putting yourself in a lot of rooms. The other thing I would add is your health is your wealth. I think so much time within medicine, we dedicate our lives to taking care of others, which is why we went into the field. But the reality is, if we don't move our bodies and we don't eat good food and we don't get good sleep and manage our stress, we will get burnt out and we will get sick ourselves, and we will not be able to provide the care that our patients really deserve. We have to take care of ourselves. We have to advocate for ourselves. And that's really hard in medicine because oftentimes it's frowned upon. I think it's probably getting a little bit better. But that I would advocate for too, is develop healthy habits to take care of yourself during all aspects of training and beyond.
Yeah, that's very well said. How can people get in touch with you? Tell us a little bit about how can they contact you, where can they find you?
Yeah, so the easiest way is social media. Michelle Pearlman, MD, is kind of my personal / professional handle. For the nutrition platform, it's bytemd.app. So that's bytemd.app. And then anyone interested in like medical services, it's primeinstitute.us. So happy to send you over that information. But, really our primary goals are, a couple. Our pillars are education, outreach, community, exceptional clinical care, and innovation. And how do we utilize technology to help us offer better care, but not replace that human connection?
Excellent. I hope you're gonna get more and more patients to be interested in this business model and somehow cure them. Thank you.
You're very welcome.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com /guest to apply. Stay stellar and level up.